During the 1890s, two theories arose to explain the role of microorganisms in human disease. The germ theory of disease stated that some microorganisms were directly responsible for human disease. This theory was promoted by Robert Koch and Louis Pasteur. On the other hand, the terrain theory of disease stated that germs by themselves cannot cause disease unless the terrain, the human body, allows it through an unhealthy body, a weak immune system, and a poor microbiome. Nowadays, we can recognize the validity of both theories, but at the time, the microbiologists and scientists of the time embraced the germ theory of disease and focused on the fighting of microorganisms rather than the prevention of disease. The germ theory of disease focused on, again, fighting the disease through the use of antimicrobial drugs, antibiotics, pharmaceuticals, and vaccinations. On the other hand, the terrain theory of disease focuses on preventing infection diseases through sanitation, meaning clean water and sewage systems, clean air, healthy, nutrient-rich live food, exercise, immune therapies, and lower inflammation. Again, for the next 150 years, scientists have been focused on fighting infections through pharmaceuticals, vaccinations, and antibiotics. The germ theory of disease largely won the day at the time. You should know both theories and be able to state them and their importance in our approach to fighting and preventing infections. The two scientists that were working on supporting the germ theory of disease were Pasteur and Robert Koch. Robert Koch particularly worked with Mycobacterium tuberculosis, which he proved was the cause of one of the most relevant infections of the time, which was tuberculosis. So the germ theory of disease focuses on controlling efforts on fighting infections through the use of antibiotics to treat infectious diseases and vaccines to prevent diseases through pharmaceuticals. However, it is also true that some of the most important epidemics of the time and in history were conquered not through pharmaceuticals, but through sanitation. For example, the bubonic plague, which decimated Europe's population several times in history, was due to poor sanitation. It was transferred by bacteria that lived in the fleas that were carried by rats. Once a good sanitation system was implemented in modern cities, the bubonic plague was eradicated. Can say the same thing for typhoid fever, which was due to a lack of sewage system and clean water. On the other hand, vaccination has also helped in the eradication of epidemics and diseases. In 1977, through vaccination, smallpox was eliminated as a world infection. The next disease due to be eliminated through vaccination is polio. However, there's still small pockets in the world where 1 or 2 cases of polio may arise every year, and that has prevented the World Health Organization from declaring polio completely eradicated. Despite all the progress in sanitation and antimicrobial drugs and vaccinations, we're still fighting infectious diseases, especially viral diseases. Respiratory infections, diarrhea infections are the most important types of infections that cause the most deaths worldwide and even in the United States. There are two types of challenges when it comes to infectious diseases that the medical world recognizes. One is that of emerging diseases. These are new diseases that have arose through several factors, like the moving of populations from rural areas into cities, or cities expanding into rural populations. An example of a disease, of an emerging disease, a new disease that has appeared due to people moving into rural areas, is hantavirus, which is a virus that is transmitted via the feces of rats. Another factor in emerging diseases is genetic changes in microorganisms themselves and industrialized production, which uses antibiotics to raise animals, which creates new strains of germs that are resistant to antimicrobials. In this map, they present you with some of the new and emerging infections that have been identified in the past 100 years. So keep in mind that an infection that has been identified 60 years ago is still considered a new infection and an emerging disease. So take a look at some of these, especially something like Legionnaire's disease. Notice the one of the ones that are missing here will be, trying to see if it's in here, the Zika virus, which this was even more recent than any of these right here. It was like 2010, I believe it was. Obviously, COVID-19 is not here either, the SARS-2 virus. So be able to explain what is an emergent disease, the factors that cause infectious diseases, new emergent diseases, and examples of some of these emergent diseases. On the other hand, re-emergent diseases are those that are caused by microorganisms that we think have been under control but now re-emerge. Part of it is due to a lack of vaccination, a population that is too lax about infectious diseases, the drug resistant that has emerged in some of these microorganisms. Also, the fact that we do have an aging population and we have a large population of immunocompromised individuals through cancer therapies, transplants, AIDS patients, etc. World travel may also bring about re-emergent diseases, and again, industrialized food production, which gives us sterile foods that are more prone to be infected by pathogens. So, out of these PowerPoints, you should definitely know the two theories that we talked about, the germ theory of disease and the terrain theory of disease, and then be able to distinguish between emergent diseases and the factors that cause the advent of emergent diseases and re-emergent diseases. Examples of re-emergent diseases will be something like tuberculosis, which we might have thought it was conquered, and then it comes back again, largely in this case due to resistance to antibiotics. Another one could be measles. Again, in this case, the cause could be a lax in vaccination.